Hi, and welcome to Real Nurse Stories. Today, I'm thrilled to interview Emillee, and Emillee is a mental health nurse who's working in regional West Australia. Welcome to Real Nurse Stories, Emillee.
Thank you for having me.
Oh, you're welcome. It's very nice to have the opportunity to interview a mental health nurse because I haven't actually had that opportunity to interview a nurse working in mental health. So fantastic opportunity to share your story and look forward to hearing all about it. So welcome.
Thank you very much.
So let's start, Emillee, right at the beginning of your journey into mental health nursing. And maybe if you could just share with me what made you decide to become a nurse in the first place?
Sure. So essentially, I started off actually going into Bachelor of Science, which I didn't like at all. So I decided that nursing would be the next step. Ultimately, most of my life, I've always wanted to be a doctor, but I missed out on a couple, of the entry exams, and so I thought I'd go the back way in. And it's turned out to be quite great, really. I never thought I'd be doing mental health nursing.
No.
I kind of fell into it. I never got the opportunity to do a new grad per se.
Uh-huh.
So I applied for a lot of jobs when I first graduated, and I was accepted by a private hospital in New South Wales, a private clinic.
Yeah.
And that's basically where it started. And it's gone on from there.
So the private clinic that you were accepted as a grad, was that working with patients with mental health?
Yes, that's right.
Yeah.
So basically, it's private, so it's less acute. It's more people that are in recovery, essentially, or supposed to be.
Yeah.
And that varies from addiction to personality disorders and everything in between.
Gosh, I bet that was interesting because did you cover much of the sort of mental health aspects in your training?
No, I know for me, I graduated through University of South Australia,
Uh-huh.
and they only did one mental health subject in first year.
Yeah.
I'm aware that in other states and through nursing friends that they do a little bit more these days
Yeah.
in their second and third year, like for uni in Sydney and stuff like that. I know that they do more now,
Yeah.
but I was never educated enough to know what I was walking into, that's for sure.
No, I'll bet. That must have been a bit of a kind of culture shock in many ways.
Yeah, it was. I think because you get taught this expectation at uni, and kind of it's all about clinical work. And I think that I've got a pretty good, social personality anyway. So that side of things wasn't very difficult. But you have to reframe everything you do when it comes to nursing, because it's not that physical, hands on
Yeah.
clinical work that you've been working towards, for the last 3 years. I didn't
Yeah.
even get a placement in mental health. So it
No.
was a very different environment.
I'll bet. I'll bet. I always find it fascinating as well that we still have those kind of two branches of nursing quite separate from each other because when you think about, especially these days, the two things really go hand in hand. So many of the patients that we see, on a general ward or in a general setting can have mental health issues as well. And I think to have it as a separate subject, yeah, there's kind of schools of thought around that. But I think as a nurse, it's beneficial to have both of those subject areas, really, to be able to care for somebody from a
Yeah, agreed.
patient-centered perspective. Yeah, yeah. So how long did you do that for, Emillee?
So I worked at the clinic for just over a year before I moved across to a completely different area of mental health. I went into working with mums and kids, or babies actually.
Yeah,
So mums had mental health issues, and their babies were between 0 and 5 in a community setting. In Liverpool and Sydney, and it was really great because it gave me a whole nother perspective. So we were basically, having mums and their babies come and stay in a 3-bedroom unit. There was 8 of them on site, and it was just basically helping them parent, but with a mental health issue. A lot of them had personality disorders. We had a couple mums with schizophrenia, and basically it was about helping them parent so they didn't lose their kids. It was kind of like a last kind of chance for them to show that they could work around their diagnosis and incorporate that parenting and that safety and attachment with their children. And I loved it. It was really great. It was very hard at times, but
Yeah.
I mean, holding babies every day, I mean, who can't love that? So
Yeah. So that, yeah, and that again is broadening your knowledge, isn't it? You know, from where you started. So it's another kind of skill set to add to that. So yeah.
Yeah.
And then you went from there to
Kalgoorlie, actually. So I spent a bit of time out there in community mental health. So I went from inpatient to outpatient, essentially. In between, I've done a bit of SA work, regionally and metro work, so inpatient and outpatient, locked wards, open wards. So I've kind of gone from one to the other, and currently working in a psych liaison nurse job in ED. So I think that I've covered most bases of, I think, mental health areas, and they've all been extremely educating, and I've learnt so much throughout. So it's been great.
And that's challenging, actually, working as a mental health psych liaison nurse in ED is not an easy role either, is it?
No, it can be very exhausting to say the least. But I mean, look, people always ask me if I enjoy my job, and I have to say I do really love it. Obviously, it comes with a lot of downs and lots of ups, but it's definitely something that I really thoroughly enjoy. So,
how come you made the move to Kalgoorlie? Did you have connections in Kalgoorlie, or how did you?
I was looking for a bit of a change, and I guess there was just some organisation issues with the company that I was with. That was a non-for-profit organisation, and it was just going in a way that a lot of us nurses there didn't want to kind of go with. And so I kind of put my foot into the travel nursing world, and I got contacted and did an interview, and within a couple of weeks I was driving across the Nullarbor. So it was a very quick change. I guess there was also the opportunity to upskill. I worked in the depot clinic there, and I also managed the clozapine patients as well. And it was probably my first real case management role. And what a way to dive in a regional rural place where there's no resources, or minimal resources. So that was very interesting. But I absolutely loved it. It was great. The community in Kalgoorlie is amazing.
It's a very different area to where you'd worked previously, isn't it? Kalgoorlie.
That's very different.
Yeah. And I mean, were there some challenges for you personally in kind of moving to an area where I'm assuming you didn't have any connections already, you didn't know anybody there?
Yeah, it was very it was a bit hard. I think that for me, I'm kind of pretty good at change, but it was a bit hard for the first couple of weeks. Payments weren't going through and all that sort of bits and pieces. You moved into a little studio where it was very old and smelly, and you kind of had to just roll with it because you were there by then. So you didn't really have a choice to just get up and go drive back across the Nullarbor.
No.
And meeting people was a little bit hard to start with because, I mean, for where I'm in nursing, I'm still probably quite a young nurse and also young in my job. So I kind of come across a lot of older people, which is great. But for the circle of friendships, everyone's at different stages. So, but once I got off the ground, it was great. I met a lot of great people, and I've still got quite a few friends out there. So
that's good, because it's quite a challenge, that, isn't it, to move somewhere completely different to a new role where you don't really know anybody. Everything is new in that sense, and working in mental health in itself is a challenging job, or can be a challenging job at times. And that must have been kind of quite a big change on a personal level for you.
Yeah, it was. And I think that, I came from Sydney, so um, the drive itself was very exhausting. But, I left a lot of friends and all my family over east coming to Kalgoorlie. And I guess it was very expensive to fly anywhere from Kalgoorlie, and I think it still is. So, and this is all before COVID. So this was 2019.
Mm.
So going back home wasn't easily available. Return flights were over $1,000, so you could go overseas for that.
Yeah, I know.
It's quite, it was quite hard, and I guess also learning to say no. It was probably a very big learning curve for me, just due to the fact that I like to work hard and there was a lot to do, and it wasn't shift work anymore. It was Monday to Friday, and so you constantly felt like you had so much to do but not enough time. And due to it not being a 24-hour service because you're in the community, it was about learning to balance life and work, and have to understand that you can't finish everything even if you want to, which is a struggle for your own personal, morals and how you think that you should be working and what standards you should be working at. So,
did you have any mentorship, Emillee, around that time? What support did you have on that journey?
I met a very lovely lady who I worked very close with. She's actually a nurse practitioner in mental health, but she's from New Zealand, and we hit it off quite well. She and I guess went through the whole process and Kalgoorlie journey together. And she's still a constant, mentor for me. We always touch base, not just for our friendship, but also through nursing as well. We've got quite aligned ways of thinking and learning. And I mean, she's probably the older version of me. Sorry, Lindley, but I think we do things very similarly, and she's taught me a lot. I've met quite a few lovely mentors through my time, and even from back at the clinic in Sydney, I had very good support from the nurses, which is quite hard these days to hear that a lot of nurses do have trouble with bullying and harassment and other nurses just being rude. And I just think we're in a world where, look, currently COVID has ruined so many things for people. We need to get around each other and really support each other. So I've been very lucky in that sense.
I totally agree with you when you say that, Emillee, because I think it's, it can make such a difference to have support when you're starting off new to something. And mentorship is such a valuable thing, and yet it's often underutilized. It's not always the thing that people automatically think, but to have that person who can support your career journey is fabulous, really. And I think often makes the difference between someone staying and someone leaving.
Absolutely, I agree with that. And I think supervision is an under talked about, undervalued resource, but it's not readily available to nurses. And I know in a lot of my positions I've actually had to push for it, and even then it's been a really hard kind of battle to win, because for some reason nurses really get left out when it comes to supervision and that sort of thing, and it gets put in the same kind of group as being management, your management review and stuff, which isn't the same, because you need a safe place, and it doesn't matter what area of nursing you're in, everything affects people differently, and it's this, even the smallest things that you may not even think about, that when you're caring for somebody, it resonates something inside of you, and you think, oh, this has really upset me. Who do I go talk to about it? And you can feel really scared about bringing those things up. And I guess you don't want your managers or your supervisors to think you're weak or that you can't fulfill your job, but there needs to be that debrief, and it doesn't matter what situation is or how big or small the situation is. We should just have that resource more available to us. Absolutely. In my opinion,
it always surprises me, because most of my nursing career was in the UK, and there was a lot more access to supervision, across clinical supervision, across both general nursing and mental health nursing, and it surprised me a little bit when I came to Australia that that didn't happen in a structured way, you know, for many nurses, unless you seek it out yourself. And even then, as you say, it's difficult to find access to supervision. And can I just ask you, was your supervision separate to mentorship, or was it kind of combined with the mentorship?
I think it's a bit combined. I did have the opportunity with the Mums and Bubs facility where they did get a group supervisor in, but I felt that wasn't really good enough in the sense that everyone had different personalities, and if there was interpersonal issues, then a lot of people still felt they couldn't speak up. I think that for me, I've always been taught to talk, and I'm a talker.
Yeah.
So for me, if I need to talk about something that's upsetting me, I will.
Yeah.
And I will find someone I feel safe with. But for some people, they don't feel that they're able to. It shouldn't just be, oh, here, go see your employee assistance program to talk about. That's not what we're talking about here. We're talking about supporting nurses no matter where they are in their nursing career. And I've seen very, very experienced nurses burn out, or, you know, have trauma that they just didn't realize was even there, PTSD, and they've just quit nursing because they were never supported throughout. And especially in mental health nursing, for me, you know, we see so much, and the stories that we hear every single day, sometimes I do think, am I actually normal? Because
Yeah.
you know, you go home and you think, oh, it was a tough day, and then you reflect, or, you know, I have a chat to whoever I talk to, mum or dad or whatever, and I think, man, that's heavy, you know, maybe I need to go and like debrief about that. And you don't really realize, because I guess the environment of nursing is that we don't really get the opportunity to say, hang on a minute, we shouldn't actually have to put up with this.
Yeah.
Or this has actually been a big day, I need a bit of time out to get over this incident. It's always like, oh, you'll be right, you're a nurse, this is what you signed up for. So,
and it's so much a missing component of support, you know, to have access to supervision and debrief, you know, for those critical incidents that occur, are so important. And as you rightly, you know, talk about, they're really important in terms of making a difference for somebody leaving through burnout or not. And I think there's so much more access that we need to provide to both of those components, well, all of those components really: mentorship, debriefing, supervision. They all have a place, but at different times and in different ways. So
that's right.
You know, I think just to come back to your supervision, Emillee, because I'm really interested, and I think people listening, you know, just kind of to explore that a little bit more with you in terms of when you seek out supervision, is that supervision from somebody who is a qualified supervisor in that sense, or somebody who's senior? How would you do that practically?
For me, currently in my job, I see the consultant psychiatrist fortnightly, and we discuss cases that I see through ED, and we talk about either what I wasn't happy with, or if there's a situation that happened, we kind of discuss that. And that was kind of just set up from the get-go, from when I started the PLN job. When I was in the community team, I didn't really have that option, and we were told that we could organise someone ourselves, and they would pay us the return trip to go and see them for an hour a month or whatever it was. For me, I just look for somebody that I feel safe with, usually that someone's had quite a bit of experience. So for instance, my friend Lindley, she's a nurse prac in mental health, so she's very wise and you know, been through a bit. She's older. She's been through the different jobs and situations, management. I mean, there are people out there that specialize in supervision, and you can find those, but for me, I wouldn't even know where to look. I think I've just been lucky to go, oh, hang on a minute, I like you. Do you think you can be that person to debrief with me? For a more of a professional, I would go to my consultant psychiatrist and we have that discussion. It's not a, I guess, a formal written one where we, make notes or anything, but it's still something where if I'm not happy about a situation, we can talk it out without any kind of judgment on that. So,
and that's it, isn't it? It's that safe, non-judgmental space that you can talk through a challenging situation in a way that isn't going to make you feel that you don't have the skills, or you're taking it away and overthinking it, and that's psychologically not doing you any good. So in essence, what you're saying really, Emillee, is that you have sought that out for yourself, both in terms of mentorship and clinical supervision, because you identified this is somebody I feel comfortable with and I can trust and they can support me.
That's right.
Yeah. And that's really interesting. Sorry, you go.
Sorry.
No,
I was going to say the other thing is it's an area and time where you can talk about things without having to really filter yourself. And I think that's a big thing when, obviously people say you have to be professional. It's all well and good to sit there and put up with someone screaming profanity at you for 2 or 3 hours, whether or not they're unwell or not. But then to be able to go, well, that person was being an absolute jerk, and that be the environment where you can actually unload that as well. And I think that's really important, instead of building up that resentment for your job and for your, for patients then. And I think that's part of the issue with some, colleagues I've met, is that they've just, instead of putting their feelings in the right place, that built up resentment for the job becomes a personal attack on patients when they don't truly mean it. It's just that it's been a long-term kind of environment and they just don't know where to put those feelings.
That's also true. It kind of presents itself in this tough, hard exterior, doesn't it? Which is almost a self-protecting mechanism, because they haven't had those opportunities to, talk and work through that, and they carry that. And I think longer term, that affects teams. It certainly affects the person themselves, and it also affects patient care, because we know that the outcome of not having the right support, there's lots of evidence to suggest that's not good for patient outcomes, because we lose our ability to kind of empathize and be compassionate because of this hardened exterior. So I think it's such an important thing. And it's really interesting for me, because I know from kind of some of the work and reading I did around mentorship that there's some evidence that says mentorship works best when the mentee chooses the mentor. Which is interesting, because that's exactly what you've done. And there are also occasions where I know people are kind of said, oh well, here's your mentor, and don't have a choice in it. But it's actually, I think, really important to have that personal choice about, do I feel comfortable with this person? Is this something that can help me? Is this person someone who can help me in a way that will help me to grow? Which is what you beautifully explained, and I think it's such an important support mechanism, actually, for all aspects of nursing, but particularly mental health, and particularly when you work in ED, because there's certainly some challenging circumstances that you have to deal with in ED. You never know what's going to come through the door, and
that's right.
Yeah. So some of the topics that you gave me, Emillee, that you wanted to talk about today were we've talked a little bit about psych nursing, rural, remote, but you've also mentioned about reducing the stigma in mental health. And I just want to explore that a little bit with you in terms of why that's important to you.
I think that it's probably a bit of a personal thing as well as just also a professional kind of area. I think, especially in the society that we're living now, I mean, even as a personal kind of thing, COVID has really rocked myself and a lot of other people. Where I moved to, I'm quite isolated. I'm in a regional area where in WA, the regions got all locked off for isolation. So the one person that I knew was south of the river essentially, and I couldn't cross the border to go and see them. So I was essentially stuck out with nobody. And I just think, wow, you know, if people already felt isolated or lonely before COVID, how are they actually coping at the moment? And I think people, with all the posts and articles I've read over the last year or so, it's really made me kind of sit back and go, wow, like, you know, people really don't understand what mental health is. And I know a lot of people roll their eyes and they think, oh, they're just using it as an excuse. But I think people need to understand there's real, true reasons for how people feel. And it's not just that they're flying around that I'm depressed or I'm anxious. Some people really battle every day to get out of bed. And probably more so now that COVID's hit, I think a lot of people who never worried about mental health or didn't feel that they've had any experience themselves with mental health are starting to actually feel, oh, hang on a minute, all of my ideas about what mental health is, I've been completely wrong. And I mean, I've seen a lot of people who up until this point have probably, you know, coped fairly well through their life. They've had a few, you know, bumps and, you know, dips, but they've never felt like they are now, you know, not being able to go interstate, go overseas, see their new grandchild, go to funerals. It's really been a detriment. And I think now is a time to kind of start pushing that people can come forward and talk about it, because suicide rates are, I believe, are going up. I've had a lot more, you know, names cross my desk recently, and it's really sad because I think, you know, there is no one pointing at this area and saying we need to put more money or resources into this. In fact, we're just doing the exact same thing with the same kind of resources and amount of money we had before. But in fact, I think it's increased enormously in the last year to 18 months. So for me, it's about breaking down those barriers, finding out why people are so, you know, against what mental health is, and finding out how we can better explain things. And for me, I always have a discussion with my ED colleagues about the safety of mental health patients. And I think as a nurses, one of the biggest things that I find with colleagues who don't necessarily want to look after mental health patients is that they don't understand it. And I kind of use this saying where I wouldn't give someone unsafe to look after, just like they wouldn't give me a cardiac patient to look after, because that scares me insanely. And like, you know, I just think, oh, I wouldn't even know what to look for anymore. And I think that's kind of what I compare them to, is that, you know, people in the ward that get worried about having mental health patients, I say to them, you know, 70% of your inpatients at the moment probably have a mental health issue, but they just haven't been admitted for mental health. So how can I break that down? How can I help you to understand what's going on? Because I think people see mental health as death and suicide and self-harm, and they don't know how to talk to somebody. And it's funny how we go, oh, you know, it's okay to be okay, let's talk. But then no one seems to know how to talk to people. And it's like, we do this every single day. There is no difference. We've just put the words mental health in front of it. So it's really about, I think, just understanding where people are coming from in that, and saying, you know, actually, it's not that I don't want to work with them. It's just I don't know what to look for or how to understand where they're coming from and what I need to do. How do I fix them? as you fix other people with medications, you put a wound dressing on a wound, whereas mental health, it's it's different. So
and I think there's so much truth in that, in terms of, I often wonder, do we hide behind a little bit behind the, I want to say somebody having a label of mental health, from a general nursing point of view, that we see that and think, oh, we don't have the skills for that. But actually, that in a way, that's almost an easy out, isn't it? When really what we need to be doing is, as you so, put that in such a, describe that so well, is being open to understanding more about mental health and what it is, and how to have those conversations, how to ask. And I find it fascinating, because I had not a mental health experience, but a similar experience when I was working in a senior role. About part of our role was to go and talk to staff on the floor and have those conversations. And I used to love that part of my job, going, just literally, how are you going? Is there anything you're struggling with? And I had a conversation with someone who was very senior to say, I'm struggling to understand why there's a reluctance to do this at a senior level. And the reply was, well, not everybody knows how to open that conversation and how to ask those questions. And, for me, I had never considered it from that viewpoint, because I love to talk to people, and I didn't see that as being difficult. But when you stop and think about it, if I think about it in the context of mental health, I guess that same, well, how do I do that? That same question applies also in that setting. And to have those opportunities to learn, or to watch and listen to how somebody does that and learn from it, you have to be open to the learning, first of all, don't you? It has to be,
that's right, yeah,
something that you want to learn from. And I also think COVID has highlighted so many things, that have, it's brought things to the surface, actually, that weren't there before.
Agreed.
And especially in nursing, I think, nursing, as we've kind of covered earlier, has this kind of history of pushing things under and not talking about them. And I think because those issues were already there, COVID has almost brought this more up into the open, and there certainly seems to be more awareness. So I wonder, conversely, whether COVID may change things in a good way. That's the optimist in me.
Yes, well, it'll be interesting, I think. I have lots of frank conversations. I work with a really good crew of people in the ED, actually. I've really loved it. And I get to watch all the other cool things that I don't usually get to do as much anymore, because I was trained as a general nurse. So they often say, I'm just a psych nurse, but then I can still, do bits and pieces. It's just about remembering everything. But I often say, if there isn't really much difference between having a discussion with each other and with a mental health patient. If you want to know something, you just ask. And I think the biggest thing is people are worried about hurting feelings. But at the end of the day, when someone's in crisis or somebody really needs your help, asking them direct questions are the only way you're going to get answers. And as a mental health nurse, majority of our work is based on the person and what they're telling us. And then obviously with experience and learning different cues, you can obviously, work your way around whether or not they're telling the truth or not. But majority of the time we have to take the person's word, and it's not about judging them and saying, well, this is silly, that, if it was me, I'd be going through this differently. It's just being there for that person and seeing where they're really at. And you can usually get a good idea of something and how something's going by just having a conversation with them. And I don't sit in front of somebody and go, have you got a psychiatric illness? Have you used drugs? We go, what do you do? What are you doing with your life? What's happening at the moment? And you're not having a good time. So tell me why. And it's exactly how I would probably talk to my, best friend or a colleague. And I think that's where some people think, if you do cardiac workups or pathways, you've got to follow A, B, C. But with mental health, there is no real protocol. It's just about ensuring someone is safe to start with, but then also finding out what you can do to help. And I think that's where nursing, because we've been taught so many clinical things, that we get to mental health and we go, oh, there's no textbook for this. I mean, to a point there is, but it's really just about learning what different behaviors and everything. It's not like when you see a psych patient, take blood, do this, do obs, and then send them out the door with a prescription. So I have really enjoyed it, and I have done a role in the past where I've educated on schizophrenia and bits and pieces like that, and it's really interesting to see people's view on the circumstance and that diagnosis change just purely because they're educated about it.
Yeah. It's interesting because I did an interview for somebody a couple of months ago who works with vulnerable communities that are homeless, and she used a term which really, I think it will resonate with you. She talked about conversational assessment in terms of sitting and having a chat with someone to understand exactly that. Where are they? What's going on in their life? Where do they most need help from? And it's such a different emphasis from the clinical process that we've been taught to go through mentally, and I think to have a conversation like that, it's about I'm a human and I'm wanting to help you, but I want to connect with you and understand your perspective to know how best to help you. That's fundamentally such an important part of every connection, really, that we have with a patient, not just a person with a mental health issue. It's but we make it way more complicated than it needs to be.
Than it needs to be. Yeah.
But I think that's so true. How do you look after you, Emillee, in terms of, I know you have mentorship and you have supervision, but what things do you do to keep you kind of in that position that you're able to do your job well? How do you take care of you?
I mean, I've been stuck out in the middle of nowhere for a little while. So some things I haven't been able to continue as much as I've wanted, but generally speaking, like, I like to do a bit of exercise, like gym, walking, hiking. I enjoy reading a lot. I kind of try to keep the things that I like to do as an enjoyment thing. So I love to bake and cook, and so I often bake for work people or anything like that. I just find it's a time to like let my hair down and just enjoy doing something other than thinking about work. And I think I learned something in my first year of being in the mental health clinic. One of the clinical psychologists, she spoke to me one day after I got really frustrated about I felt like I just wasn't able to help a patient. And I was getting really frustrated, and she just said, Emillee, you've got to learn limited compassion. And I said, oh, I don't understand what that is. And she said, because if you use all your compassion on every single patient, there's nothing ever going to be left over for you. So she said, as much as you want to help somebody and you're compassionate and passionate about helping somebody, you have to limit that and say, I've done what I can, and now it's up to them to take responsibility and accountability for their actions, and you have to be able to let it go. And probably from that, it doesn't mean that I haven't had patients where I go home and I get, I worry about it or think about it. But I probably feel that I can walk away from my job at the end of the day and not go home and think about it. I can just literally switch off. And I think I know that it's probably one of the hardest things for a lot of nurses, especially where you feel that you aren't meeting the standard of care that you
Yeah,
thought you could be, working
yeah,
to. And I've just been having a lot of these conversations actually with a lot of my colleagues, young and old, about how it's kind of comes down to what we call morale injury, I guess,
mm,
where you feel that you have this, you go through uni, you come out of uni, and you have your own personal expectation of a standard of care that you think you can, meet.
mm,
But then when you're given the resources, the area that you're working in, you may not have that ability to ever reach that expectation. So you constantly go away feeling like you haven't been able to succeed.
mm,
But what I've learned over the years is that anything you've done between that level, you've still helped a patient. And
yeah,
even we're never going to be able to reach that standard in this society at the moment with the limited funds, the limited resources, especially in my line of work.
mm,
It's an ongoing issue. And I've just had to go, okay, whatever I can manage to do today is good enough. And they will be okay and I will be okay and tomorrow's a new day. And I think that's what a lot of nurses have kind of agreed with me about, is that especially in mental health, we are more burnt out from a Monday to Friday 8 to 5 job, because as soon
yeah,
as you close that door, you know that tomorrow
yeah,
it's going to happen all over again. And that's why I like to emphasize that nursing in the areas that are shift work, that it is a 24-hour care, because realistically, when you're changing that shift, you're going, I'm handing over, you know, what I've been able to accomplish today. Please keep going. And I think that's really important as well.
yeah, yeah. And it is, because it stops that cycle of feeling that you haven't, been able to do everything that you need to do. And again, I know nurses who carry that home with them, that burden, that almost, I've forgotten to do something, or I'm checking my emails, or it doesn't help us to have our own cup full, not full from not, taking care of
Yeah,
us. I'm
yeah,
not said that correctly, but you know what I mean.
yeah,
And
that's right.
I think to understand, it's almost like there's a coaching term for reframing something. So what you've described there, it's almost like, rather than thinking, oh, I haven't done enough, or I haven't done everything that I needed to do, you turning that message around to say, I did the best I could do in the time that I have, and that's okay, because someone else coming on now can continue that. And I think it's a great way of reducing the pressure on yourself, actually, and keeping yourself resilient, because you can't practically do everything in a world where, as you rightly say, there's limited resources. That's always going to be the case. We're always going to have to do more with less. But how do we cope with that? And I think that's a
Yeah,
really good example of how to look at a huge workload differently and make it a manageable chunk, if you like, that you're not going to beat yourself up over because you didn't have the time or the resources to do everything. I think, yeah, it's a great
yeah, that's right.
example. Great example. It is. It is. I love that. Do you have like a network, Emillee? As you were talking, I was thinking, do you have kind of like a virtual network of mental health nurses in other areas, or?
I mean, I've kept in contact with pretty much everyone that I've met over the years. And I think I work elsewhere as well. I work in the metro on top of my public job, and I do
Yeah,
shift work there. And I guess for me, that second job is more of a social thing for me, as a lot more
yeah,
people my age and kind of from England and Ireland, like everyone's different there, and it's
yeah,
another private clinic. But we socialize, we hang out, we discuss things, and we still have, you know, heaps of fun, and but mental health nursing, a lot of people think that there's a lot of us, but realistically the cohort of us are quite small. And you don't realize that a lot of the time you've worked with people that colleagues have worked with interstate. So I've met a lot of people in Sydney who have actually worked over here in Perth and vice versa. So I feel like the community of mental health nursing, it's always easy to kind of plug in and continue that kind of, you know, discussion or relationships, because we're such a small cohort of professionals, I guess.
Yeah. And that's great. That is great to have those connections. But it's kind of my thought process was around, you know, there'll be other nurses working in mental health in other parts of regional Western Australia, or even, you know, interstate in regional healthcare. And, you know, how is there a mechanism for those? So if we take, let's say, Western Australia, is there a mechanism to connect other nurses working in regional areas?
Well, not that I know of currently.
No.
I think it would be nice. I mean, for instance, where like the region I work in, there's only 2 PLNs and we cover the whole region. So it's only a couple, like, you know, and in that, I guess there are mental health nurses, but essentially they're all, I've already I know who they are, if that makes sense, in this region. So, but no, we don't have anything that's really, well, that I know of in WA that you can just kind of organise or talk to.
Because it would lend itself very much to like a virtual network, wouldn't it? Where you could all come together. It didn't, you know, you could set the time frame for that, but there must be other nurses who are also in similar roles to yourself in regional Western Australia, who are also feeling that sense of isolation, you know, because it is working out in a regional area, and as you say, there are not many of you, so maybe that's something to think about, you know, how you connect with each other and have that virtual get together, whether it's just to, you know, come together with a cup of coffee and, you know, get to know people. There's lots of different ways you could do that, but it's something that would probably be helpful as well as all the other things that we've covered today, you know, just from an informal networking point of view.
Yeah, agreed. I mean, getting together for coffee is always great.
It is. Sometimes it's a bit hard to do if you're all so far apart, but there's, you know, that could be one of the options, that, you know, you do that a couple of times a year or something. There's many different ways to look at it, but what advice, Emillee, would you give to somebody who is maybe where you were when you finished your training? There are lots of newly qualified nurses who are struggling to get grad places, and, you know, mental health might not be on their radar because they're perhaps got aspirations to work in other areas. What would you say to somebody who's listening to your story, and, you know, if they were thinking about making perhaps a slightly different career plan than what they'd envisaged, to consider mental health?
Well, I graduated with the idea that I was going to be a theatre nurse or an ICU nurse, and how wrong was I? Mental health is not easy. Just I know a lot of people make that comment that nurses go into mental health to have it easy, and it's further than the truth, because I mean, you only get out of it what you put in, essentially. And if you want something different, if you want something rewarding, then mental health nursing, even though it can be hard, it's a fantastic area of nursing, and we're always needing more mental health nurses. But give it a go. I think it's not like other areas where you can try it out in placement and think, oh, this is where I fit. It's really about finding an area that you feel that you fit in. And I really thought that I was never going to find my place in nursing. I thought, oh, I'm never going to find a fit, but I did. And you've just got to give yourself a little bit of time, because I think there's, like I said, there's so many expectations with your nursing course that you come out thinking that it's all going to be this great fun, and it's really not. In some ways, it's not. It's stressful. It's draining in all ways.
Yeah.
But mental health nursing, I think there is just an abundance of different roles that you can be part of, and it stretches from children to older adults and everything in between. So, you know, I think you've got more of a chance of liking it somewhere along the line. So, and we have lots of fun too. We have lots of fun in our roles. So, yeah, I just think give it a go. I think forget about what society tells you about it and step in and have a go. And if you don't like it, at least you can say you've had a go.
Yeah. No, that's great advice. And I think, it's again, having that open mind to possibilities, isn't it? And thinking, hey, and I'm sure people listening to your story, you're such a passionate advocate, Emillee, for mental health, and in so many ways, just talking about your experience in the way that you have, and talking about the things that have helped you grow as a person in terms of mentorship and supervision. You're a fabulous advocate and role model, actually, for other nurses who maybe haven't thought about a career in mental health. So that's hugely important, because we need nurses in mental health. We absolutely do.
We do.
We need more,
especially in regional and rural areas. It's great fun. I think that I have had lots of experience as a young person and as a young nurse, where a lot of my friends that went straight into metro nursing probably haven't been able to have. And everyone's, each to their own, but you just meet some of the nicest people along the way, and you get to see so much of different places, as well as really help people in need, especially in small communities that don't have, people who care. And that's what I love about mental health, is that you can, impart what you do and how you feel into someone else's life. And even just having a conversation with them, you have no idea how long that stays with somebody. So
absolutely. That's hugely important, isn't it? And that's what people need. It's that, somebody to actually stop and take the time and listen to them and try and understand. And that's sadly the thing, that in the busy, fast-paced world of healthcare, we don't always stop and do that very well. So I think, it's a basic human need, isn't it, really?
That's
right. At the end of the day.
That's right.
What would you most like to be remembered for in your career, Emillee? I know that you're kind of still on your journey, but I'm fascinated to know what you would like to be remembered for.
I think, if anything, just somebody that always advocated for patients. I think that, we get paid to do our job, and that's fine, but patients don't. They have this journey that they're on, and if I can help them recover or put them in the right direction, then that's all I came into this job to do. And I'd like people to remember me as someone who was nice enough to sit down and have that cup of tea and Vicky with them and say it's going to be okay, because I've seen lots of people get through this, and you can too. So I love my job, and I've got a lot of years ahead of me, but I love every aspect of it, and I'm always happy to help others get into it and help them along the way too, because I think it's important that we all help each other and support each other.
Absolutely. Emillee, it's been a real pleasure to chat with you today. I think you're such an advocate, really. It's so nice to, interview somebody who is so much a champion for mental health in so many ways. And I have no doubt that, you'll continue to do great things in mental health. I have no doubt about that. And I think, you've shared so many things today that are so important for other nurses to take away and learn from your experience. So thank you so much for sharing your story today. You're very welcome.
No worries. Thank you.